So, last video that I did actually had so much traction on the channel, and I thought I would do a video that is quite similar. And a lot of you people actually love this raw, unedited content. And yeah, where we just sit and just talk about certain things. So, I did a video about failure on the previous podcast. It's a podcast. I'm going to call it a podcast because I can call it whatever I want. So I did a video about failure, and it actually got quite a good response from you guys. And I saw one interesting comment where someone wanted me to talk about the transition from ignore the sweat. I'm in the car and it's freaking hot today. So I saw a comment where someone wanted me to talk about the transition from preclinical going to clinical, because I think it's something that is underrated and something that you're not prepared for. So I wanted to do a video that talks about transitions in pretty much medicine. Not just the transition that's going to be in the preclinical to clinical, and also not just the transition that's going to be from clinical to practicing medicine. It's going to be everything, what you really need to know when you're getting into medical school, the things that I wish someone had told me and sat me down and actually explained all these things to me, because if they did, maybe I would have chosen a different path, but I'm only joking. I don't think I would have chosen a different path because it's medicine or nothing else. So as you already know, medicine is one of the most challenging things that you can actually do. And the transition from going from pre-med into medical school, because I think the first 2 years, by then when I was doing medicine, pre-med was like 2 years. So for the first 2 years, you're going to be doing your pre-med. Then you get into medical school, what we call the preclinical. Pre-med was pretty much as a breeze. You would have classes here and there. It's more or less similar to high school, not so different. And you can actually make it there if you're just attending the classes, reading through the slides, going through a lot of practice questions. I think you can make it there. Now, the biggest challenge came when that transition now from third year going into fourth year. Fourth year was quite hectic. It tests a lot of, sorry for the background noise. I know this is going to be pretty much unedited stuff, so sorry for the background noise. So fourth year was super, super hectic. And it's 1 year that's going to test you mentally. It's 1 year that's going to test you emotionally. It gives you so much PTSD. Even when I think about it right now, I get anxiety because fourth year was quite hectic, guys. We had tests coming thick and fast. And I like to give this analogy that it's like you fall into a swimming pool and you realize that you're drowning. You realize that your feet don't hit the ground. Guys, it's hot. I literally had to open up both windows to get a bit of some ventilation into this car because I was sweating. So as I was saying, it's like you're drowning and really your feet are not hitting the ground. You start to panic because you realize your feet are not hitting the ground. And then in that panic, as you're fidgeting around, it's not going to help you. You keep sinking further and further, and the more you realize that your feet are not hitting the ground, the more you're actually drowning. So that's the biggest thing is not really talked about, is that the amount of workload that's there, especially from getting from third year to fourth year. You get a lot of workload that you sometimes cannot really deal with. Sometimes you feel as if it's actually quite overwhelming. Sometimes it feels as if it's emotional torture and mental torture. And then, if you don't have an escape at fourth year, you end up finding yourself doing all the wrong things. You end up finding yourself with the wrong crowd, picking up the wrong habits, picking up things that you look back maybe 10 years from now and regret. Maybe you're someone that doesn't drink. I have nothing wrong with drinking. Maybe you're someone that doesn't drink and then you all of a sudden start drinking and your life starts to spiral. So find something that is going to help you pick up good habits. Music is a very good outlet to actually put out your stress. Sometimes even going out to certain places like going out to eat, going out to do certain activities. All those things are like fun things that you can actually do. Go out to watch movies. But then, of course, the only biggest problem that you have in that particular scenario is that you're stressed because work is coming at you thick and fast. But at the same time, you want to relax and you want to unwind. So you want to do these activities, which is sometimes quite difficult for you to do. So it creates more or less like a very fascinating problem, because at one end, you know that you're supposed to be studying, you know that you're supposed to be putting in work. At the other end of the spectrum, it puts you in the situation whereby you know that if I continue doing this, I'm going to have a mental breakdown. I'm going to have an emotional breakdown. So what do you do in that particular moment? How do you find the balance? It's very difficult to do. There's no one who has the master key as to how you should deal with fourth year, how long you should relax. But one thing that I've told myself is this: if you find yourself compromising on your mental health, it means that whatever you're doing is not worth it. Take a step back, relax, refocus your things. But that doesn't mean that you should also relax at fourth year, because if you relax, you end up failing. You need to put in the amount of energy. So it means that if you're studying, there are different study techniques that you can actually undertake, different things that you can actually do at different times. So it's not like as if fourth year you should only have one particular way of studying. That's also another something that's, again, a bit different. So you should make the balances to work and play. Because remember, all work without play makes Jack a dull boy. So there's no need for you to be working 100% all the time. You should have some time to actually unwind. Now, having passed fourth year, and I'm sure if you've passed fourth year, like, congratulations, like, good for you. But having passed fourth year, someone is selling ice cream. Having passed fourth year and getting into the clinicals, there are other challenges. You often hear seniors tell you that clinicals are way much easier than pre-clinicals. And when I actually got into the clinicals with the same notion and with the same mentality, and I was in for a rude awakening, because people were saying, oh no, clinicals are way easier than this. But half the time during clinicals, I was tired. Half the time I was exhausted. Half the time I felt like I don't know what I'm doing. Half the time it felt like as if every day I go to the hospital, I have a bunch of things that I have to read, a bunch of new things that I have to know. And yeah, you go to the clinicals, and when you get there, people make you feel like as if you're dumb. People make you feel like as if you don't know what you're doing, like as if you're not even fit to be a medical student. You're not fit to be a doctor. One of the biggest challenges that are there in the clinicals is information comes at you from all different types of directions. It's very easy to feel lost. It's very easy to give yourself so many tasks that by the time you get home, you're confused and you don't know where to touch. You don't know what to do. You don't know how to prepare. You don't know what you must actually even prepare for, because you are with a certain doctor, asks you a bunch of questions, and like they look down upon you when you don't know certain things. Like, you don't know this, or even if you ask a question, they'll pretty much tell you, why are you asking me this? I'm supposed to be asking you that, and leaving you with more questions than answers. So it's sometimes very difficult to be in such an environment, especially if you are a person that doesn't like to be looked down upon. And I think that's one transition that you need to make to develop this thick skin. Because at the end of the day, there is a lot of embarrassment there. I'm not even going to lie to you, or not even going to dumb it down for you, or even sugarcoat it. There is a lot of embarrassment. If you don't know certain things, you're embarrassed in front of a lot of people. If you are presenting a case and you say something that doesn't make any scientific sense, you're embarrassed in front of a lot of people, in front of your colleagues, in front of your crush, in front of the nursing students, in front of the nurses that are there, in front of the pharmacists. Worse off if it's a major ward round. Oh my goodness. And I think people are not so well equipped for this level of embarrassment, and well equipped for this level of making you feel dull in that particular moment. And at the end of the day, well, you never know what generally their aim is. There are some people that will make you feel dumb, maybe in an attempt to help you not give up, or to help you continue studying, or to help you learn more, or to create that drive in you. Or others will just make you feel down just because they had a very nasty time in medical school and they believe that if they had a tough time in medical school, everyone else should have a tough time in medical school. Of course, something that I don't genuinely believe in, because I feel you must always make the pathway of someone who's coming after you much easier than the pathway that you had, because that's what progression is, that's what development is. And I think even the rest of the world is moving towards that harsh treatment in medicine and more or less teaching with love and teaching with compassion and patience. But of course, sometimes people take advantage of you. And I guess you understand when you become a teacher and you are actually in the system for a very long time. I've had the privilege to say that I have tutored quite a number of people, like quite a lot of people in the country. Not that I'm tooting my own horn or anything, but I'm just trying to give you some perspective over this. You get to interact with a lot of students. You get to interact with people that are very serious. You get to interact with people that are mediocre. You get to interact with people that are just getting by or just getting through. And you get to think and you ask yourself, if this person is not so serious about this, how then are they going to deal with me when I get sick? How then are they going to deal with my relative? And this is a person that's going to be a doctor very soon. You get to lose a little bit of that patience, as if you're looking at it from an educator's point of view. But of course, that's not what a teacher must always do. You must always have some patience in terms of teaching. So I sort of do understand and sympathize with a lot of these people, that a lot of these doctors that have been in the system for 20, 40, 30 years, you get to lose that patience. If I am feeling this way and I've only been in the system 2 days, and I still feel that sometimes some students are actually not serious and need to be actually shouted at, what more someone who's been doing it for over 20 years, for over 30 years? But that doesn't mean that you must teach people with embarrassment, or you must teach people with through anger or through hate. Spread love, not hate. So the other thing that's there in terms of the clinical years is that you don't have that much responsibility in terms of the patients. And I think the responsibility comes now when you make the transition from being a medical student to being a doctor. That's when the transition actually is biggest. And when I was in my final year of medical school, I used to think, so I'm going to have the responsibility of a particular person on my shoulders. Their life is going to be in my hands. That prospect is very scary. Like thinking that my mistake is directly going to contribute to this person dying, that prospect is very, very scary. Yeah, so, turned on the aircon. I'm not going to kill myself like I told you. So often I would find myself in this position when I'm very scared, because I know that at the end of the day, this person's life is in my hands. And if I don't intervene, this person is going to die. So that's one of the things that would have a lot of hurt, and it would have a lot of anxiety, cause a lot of anxiety in my heart, because I know that if I mess up here, someone is going to die. And that's the biggest anxiety that most people have coming off medical school. Not knowing what they're doing, not knowing if whatever they're doing is directly contributing to this patient's demise, is directly contributing to this patient's dying. So you never really know if what you're doing is actually working, if I can put it like that. Sometimes you do, if your patient gets better, sometimes you do. So that's one of the biggest challenges that you have in transition, is that responsibility when you move from being a student to now finally being a doctor. That responsibility is quite huge. And that task is quite huge. And that anxiety, to overcome that anxiety, half the time when I walk into the hospital, I always feel like as if, do I really know what I'm doing? And maybe I'm just a step away from killing someone. And that actually should constantly remain in your mind, because once now you become overconfident and feel like you know exactly what you're doing, you know everything, you become oblivious to certain small things that you actually miss out. And it's those small things that you actually miss out that can actually result in your patients actually dying. So the biggest, if you were to ask me what are some of the biggest challenges that you had in terms of making that transition from preclinical to clinical, from clinicals to being a doctor, is that from preclinical coming to clinical, it was pretty much the workload. Workload was a lot. Finding the balance was the hardest thing. Often I would find myself feeling like as if I'm constantly behind every single time, and I had to be constantly reading, constantly on books. And I think I lost a lot of my time that I should have actually used to nurture my hobbies, to at least become much of a more social person, if I can say, because I'm not so social in real life. To become more of a social person, I think I should have done that a bit more compared to being just on books all the time. But of course, I did have some time off here and there. I grew a bit of some hobbies. There are some things that I did out there. A lot of people actually get surprised when I tell them that there are a lot of things that I do outside school. There are a lot of things that I do. I'm not just studying. People just think like my life revolves around books and that's it. But that's not true. Then moving from preclinical to clinical, I think the biggest thing was also partly finding the balance, but mainly being tired all the time. And I think the fatigue never really finished because it's been there up till date. Being tired all the time, finding the balance between how much you should rest, and of course, knowing what you're supposed to know and the things that you're supposed to go through. It's very easy to get lost in all the confusion, to get overwhelmed in all the confusion on what you must read, how you must catch up, how you must read, how you must present yourself on the word, getting over the embarrassment, getting over the anxiety, that social anxiety when talking to people, that social anxiety when presenting certain cases. That's, I think, one of the biggest challenges that I had during the clinicals. And sometimes it helps to rehearse some of these things in your mind. Like rehearse what you're about to say. Like let's say you're having a presentation tomorrow. Rehearse the presentation. Imagine you're standing there. In the moment when you're presenting, there are a lot of coping mechanisms that you can actually use. But that's like a video for another day. I'm not going to talk about that in this particular video. Then from clinicals, becoming a doctor, I think the biggest challenge or the biggest thing that I constantly had was this feeling of not knowing what I'm doing. Sort of like an imposter syndrome, if you can think about it. A lot of people that actually do suffer from imposter syndrome, and there are some people that are actually too proud to actually admit it, but I'm not one of those people. I'll tell you that, okay, I feel like I don't know what I'm doing. And that's something that has kept me constantly studying, kept me constantly reading, constantly updating, constantly teaching people, because of that fear of having that responsibility that if you mess up, your patient actually dies. And I think these are things that are quite underrated. When people are talking about medical school, they talk about all the good things, but they don't really talk about the bad things that are there, the responsibility that you have, the anxiety that you're going to go through, the panicking that you're going to witness, the embarrassment that you're going to witness, the self-doubt that is going to be there. Because there's a lot of self-doubt throughout entire medical school up until date. There's still some element of self-doubt. Of course, it gets better as you get higher and higher up the ladder, as you get to learn more things, you get to see more cases, and medicine becomes repetitive at some point. But if you were to ask me which of the three phases is the easiest, definitely working is the easiest. It's better than learning. Learning is quite hard, but practicing medicine is actually quite easy. And I'm sure if you are able to get over these challenges and make it through to the other end, you'll be able to attest that these things are actually quite easy. Till the next video, bye.